Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit npteff.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily.
And my name is David. Today, we will be discussing autonomic dysreflexia. Autonomic dysreflexia is a life-threatening pathological autonomic reflex, also referred as autonomic hyperreflexia. This is typically seen in patients with spinal cord injury lesions above the T6 level. Autonomic dysreflexia is a result of an impaired autonomic nervous system with simultaneous sympathetic and parasympathetic activity. A noxious stimuli below the level of the lesion causes a sudden reflexive hypertensive episode, commonly caused by bladder or bowel distension, pain, or other visceral stimuli. A rise in systolic blood pressure of 20 to 30 millimeters per mercury is diagnostic of an episode of autonomic dysreflexia. This is more common in the chronic stage of recovery, about 3 to 6 months after injury. However, it can occur in the acute stage of the spinal cord injury too. This can also occur in a patient with an incomplete spinal cord injury as well. Autonomic dysreflexia is considered a critical emergency situation. Now let's look at the pathophysiology aspect of autonomic dysreflexia. An afferent input from the noxious stimuli below the level of the lesion reaches the lower spinal cord, lower thoracic and sacral areas, and then initiates a mass reflex activity. This will result in an elevation of blood pressure. In a normal individual, those impulses stimulate receptors in the carotid sinus and aorta, which then signals the vasomotor center to readjust peripheral resistance. In an individual with a spinal cord injury, the impulses from the vasomotor center cannot pass the site of lesion to counteract the hypertension by vasodilation. That hypertension will persist due to the lack of inhibition from the higher centers and needs prompt treatment, as autonomic dysreflexia is a medical emergency situation. Hypertension triggered by autonomic dysreflexia can result in seizures, cardiac arrest, subarachnoid hemorrhage, stroke, or even death.
Okay, so now let's discuss the common causes of autonomic dysreflexia. These potential causes include bladder and bowel distension, bowel and bladder irritation, a distended bladder, a blocked catheter, urinary tract infections or UTIs, and kidney stones. Now, some other common causes include things such as a noxious stimuli that would normally be painful below the level of the lesion, a gastrointestinal or GI irritation, sexual activity, labor, and skeletal fractures or electrical stimulation below the level of lesion. All right, so now it's time for some signs and symptoms of autonomic dysreflexia. These include hypertension, which is defined as a rise in systolic blood pressure of 20 to 30 millimeters of mercury, bradycardia, severe headaches, anxiousness, constricted pupils or blurred vision, flushing and piloerection or goosebumps above the level of lesion, dry, pale skin below the level of the lesion due to vasoconstriction, nasal congestion, and increased spasticity. So now finally, Let's discuss some interventions for autonomic dysreflexia. Autonomic dysreflexia should be treated as a medical emergency, so get help. The first thing that should be done is that the patient should be brought into the upright position. So this means you should have the patient sit up and lower their legs. After this is done, the next thing to do is to remove the stimulus. This includes loosening clothing or restrictive devices, unclamping the catheter and draining it, or see when the last bowel movement was to check for any bowel impactions. It is important to note, if the patient has no known diagnosis, then you will want to check their vitals to confirm high blood pressure, then sit them up into the upright position. Now, in addition, regardless, blood pressure, pulse, vitals should be monitored at all times. If symptoms do not subside, medical and/or nursing assistance should be immediately sought, and the patient may need antihypertensive medications. Patient education regarding possible triggers, signs and symptoms, and management of autonomic dysreflexia is critical.
Now that you understand autonomic dysreflexia, here is a quote from Muhammad Ali. I hated every minute of training, but I said, don't quit, suffer now, and live the rest of your life as a champion. This isn't going to be easy, warriors. Keep on fighting for your dream every single day. Keep on pushing yourself, keep on chasing it down, and go get it. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on NPTE, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow.